You see tooth loss, especially multiple tooth loss or advanced periodontal disease. We just assume that that person fell on some hard luck, perhaps, or just maybe didn't get care when they were young. But all too often, it's something a lot more significant, like depression or like anxiety. I mean, there's contributing factors to the tooth loss, and I think that's what she is saying.
All right, it's Notes from No More Hygiene. Dr. Nabors coming to us live from the beach today.
Yes, on location, Steve. We're down at 30A in the Gulf of Mexico in Florida. So
I love it. All right, so this one is fascinating today. You're taking us to the Cleveland Clinic, to a very unexpected source with some great dental advice for patients. Tell us about it.
100%. And I think if I've heard you say this one time, I've heard it a million times, is that dentistry is on the forefront of healthcare, period. And we know that people see their dentist and their dental hygiene team members more often than any other healthcare provider. And when you start looking at the tie-ins to healthcare, like we talk about on a regular basis with this periodontal disease, now the Cleveland Clinic and the Canadian Journal of Psychology, they're coming together. They're putting out information about how dentistry and dentists in particular are starting to have opportunities to help people with mental health disorders, things that are associated with more than just the teeth and the gum tissue. From a screening standpoint, when you're talking about people that have anxiety disorders, depressive disorders, and we're seeing these people on a regular basis. I think so many of us were taught in school that, if we were seeing something that was very obvious in some type of physical abuse situation, that we were bound by law to report that. But I think all too often there's other signs and symptoms in people that we're seeing, whether it's depression, whether it's anxiety, things like that we should have the ability to refer to other specialists, maybe outside our dental mindset, to help people get the care that they need.
So this is just fascinating advice. This advice comes from Dr. Susan Albers-Bowling, who's a psychologist at the Cleveland Clinic. And this is basically a tutorial for patients, all the things that they should expect from their dentist in terms of monitoring and signs and symptoms of everything from mental health issues to overall health issues. I just found this fascinating, coming from a psychologist talking to patients about what they should expect from.
Well, the Cleveland Clinic, is no joke. I mean, we know what comes out of the Cleveland Clinic. And so for them to bring dentistry into our platform of where we can help people with the things that they do, I found it fascinating as well.
Yeah, so it's a great, it's actually a great piece. This is one, and we'll put the link in with this video. This is one I'd recommend, print it out, share it with your team.
Yes.
Talk to your patients about it. It is a great piece, just a great piece of advice from, like I said, a very unexpected source, a psychologist.
I know.
At the Cleveland.
Well, I mean, I know we're about to end, but I think some of the things that we see so often, when you see tooth loss, especially multiple tooth loss or advanced periodontal disease, we just assume that that person fell on some hard luck, perhaps, or just maybe didn't get care when they were young. But all too often, it's something a lot more significant, like depression or like anxiety. I mean, there's contributing factors to the tooth loss, and I think that's what she is saying, is we need to be aware of the person, not just the problem that's immediately right in front of us.
So true. Very good. So we'll include a link to this article, actually, that came out of Parade magazine, very authoritative source.
Right. Scientific sources, right?
And a very authoritative, source.
That's right. Absolutely.
All right. Well, Dr. Nabors, enjoy your time at the beach. Speaking of mental health, there you go. Lots of rest and relaxation. So you can be back at it next week. Thanks for sharing with us. Upcoming dates, locations for No More Hygiene included with this video. Thanks, Dr. Nabors, and we will talk to you soon.
Thanks, Steve.